how did you find your path into hematology and oncology?
Well, when I did my pediatrics rotation, I realized I love children, but I could not take care of sick children because it just hurt my heart too much, made me feel too bad, and I felt bad for the parents. And it was just something where I knew emotionally I would have a really tough time seeing sick kids day in and day out. So I knew I loved children in general, but I don't think that I had the personality or the ability to separate myself from sick children and then my own personal mental health. And then for surgery, I loved surgery. I absolutely loved my surgery rotations. I really enjoyed it. I actually rotated with my dad, which was very cool. But I realized at the end of the day that for me, I wanted to not only be able to have those long-term relationships with my patients, I also wanted to have the opportunity to practice medicine in a variety of different ways, which surgery is a phenomenal specialty. And I have a lot of amazing colleagues and friends who went into those specialties. And I realized that for me, I really wanted to have the internal medicine background. I wanted to practice medicine in the clinic. And as much as I loved procedures, I really liked the diagnosis and the treatment aspect. And so for me, internal medicine seemed like the way to go. Then after that, when I was a resident, I did my hem-onc rotations, and I just fell in love with oncology. The patient relationships that I saw, the way that patients and their families really develop long-term relationships with their physicians. And the doctors that I worked with knew about grandkids that were coming or knew about graduations. And excuse me, there was the opportunity to really have a long-term relationship with patients. And then those patients who may not have necessarily made it past the first couple of months, you have the ability to help them navigate into really hard conversations, having palliative care and hospice discussions, helping people navigate a time in their life that is really, really challenging.